After axillary node dissection, you can struggle to get that arm up in the air. We're going to show you some simple techniques to get in this position more comfortably. In this movement, what we're looking for is to keep your back nice and straight so you don't start tipping, which can really hurt that lower back. The reason that people struggle to lift their arm up when they've had an axillary node dissection, they may have a scar here or they may have a scar through their breast surgery scar, is you can end up with scar tissue and tightness, which really restricts this movement, and possibly some cording coming up the arm as well. We need to be careful because as we start to try and achieve this movement, the lower back can be compromised. So I'm going to turn you around, place you against a wall so you can't tip your back and hurt your low back. With you placed against the wall, we're holding your back in position. I'm going to get you to take your other hand and place it a little bit higher than where your scar is and push in here, which protects that scar tissue and stops some of the tightness coming onto it, but it's going to force all of the fascia and skin down your arm to have a little bit more stretch. So I want you to take your arm into ease and then up into a nice long stretch, and you should feel quite tight coming up here, but hopefully not so uncomfortable in your scar. We've got a lymph node dissection scar here. The hand goes slightly above it, so we don't want to be too close to it or below it. It's really important that you cover the scar and go slightly above it, and then you hold in firmly. So this skin here should feel a little bit stretched already, so you're going to get potentially a smaller movement with the arm, but you're getting a bigger stretch through the lower part of the arm here. If you've got cording, which we don't have here, you may notice some tight bands of fibre coming up from the scar, looking a little bit like this, but more prominent, that feel stringy. That would be cording, also known as axillary web syndrome, and this technique is helpful for that. We're going to repeat that a few times. Nice smooth movements. And now I want you to just add a little bit of breath with that. So as you go up, a nice breath in, lovely, and then slowly down, breath out. And we'll do 3 more of those. And each time you're looking to get some nice stretch up through that arm, and this hand is really supporting that fragile scar tissue, which might be feeling a little bit tender, and therefore it changes that feeling through the scar. It may be that you don't have a separate lymph node scar as we've got drawn on here. You could have had a surgical approach where they've come in through a mastectomy scar or after lumpectomy, and they've gone up, causing some damage and causing you limited arm movement. In which case you may even just have some scar around the nipple area, but there's still pain and discomfort through your armpit and on lifting that arm up. This technique will still work. Even if you don't have that separate axillary node scar, I want you to take your arm, place it into the lower part of the armpit and push down. So you may be a lot further away from your actual incision line, but you're better off getting more range of movement here by pinning above the breast area. So even if you have scarring further away from your armpit or your axilla, place your hand at the bottom of your armpit and do that tightening of the skin here to protect your scar. Now you may be finding that it's a bit of a struggle for you to bring that arm across. Perhaps you've got some discomfort in this shoulder, or you've had a bilateral surgery, so perhaps it's really impossible for you to do this for yourself. Don't worry, you could ask a partner to help you with this move, and I'll show you how to do that. Start with your arm a little bit lowered and make sure they don't push too hard on your breast itself, particularly if it's still quite tender at this time. So the pressure is in that armpit area. Start with the arm lower rather than too high up. You're going to put some pressure on, and then you're going to go into that little stretch movement. And your partner should just feel that there's some tugging, that the skin wants to pull up from under their hand, but they're not having to use all of their body weight to force it. And any discomfort, just stop. Just going to recap some quick technique tips to make sure you're getting this position right. Make sure you start off against a wall. Take your hand up a little bit so you've still got some looseness in the skin, and place your hand slightly above your scar. Apply a bit of pressure mainly into your armpit area, not putting too much pressure over the breast. Then take your arm as far as it can comfortably go and expect to feel slightly limited movement and more tightness through the arm here. Move up and down slowly and steadily. Don't stay at the top of stretch for too long, that could get uncomfortable. So we want a nice smooth movement. To step it up a bit, add a breath in as you go up and breathe out as you come down. And smile with that movement. You should still find you're getting limited movement while your hand's in this position. That is normal. You get the extended range once you take your hand away. So you're looking to do 5 to 7 little repetitions like this. Take your hand away and take a look at your movement. Considerations and cautions for this technique. It's really important that you start this technique having discussed with your medical team that they want you to start working on your range of movement with your arm. Too early, you could be damaging some of the internal suturing around your surgery site. So have a chat with your medical team first. Secondly, if you have an existing condition of lymphedema or you have some swelling in the arm or in the breast area, make sure you speak to your medical team first before doing this technique, because there could be some development of lymphedema happening, or it's important that they're happy for you to go ahead with this range of movement technique. Thanks for watching, and please check out the other videos we've got together.